Beauty isn't all about a luscious set of lips or rock-hard abs. Your brain looks for more subtle clues that indicate whether a person is healthy.
Right. External beauty is only part of the whole picture.
Even before MRIs and blood tests, our brains could sense authentic beauty in a fraction of a second.
Because authentic beauty reflects health.
Our new book will not only help you look your best, but also feel your best. Because when you feel good, you look good.
It's all part of you being beautiful, inside and out.
Hi, I'm Dr. Mehmet Oz, here with my good friend and co-author, plastic surgeon Dr. Arthur Perry. For some people, a variety of cosmetic options may be right for you. With nearly 2 million cosmetic surgeries a year and 10 million minimally invasive procedures, and nearly as many reality shows detailing them, it's clear that our culture has embraced these beauty enhancement options. Arthur is going to give us a quick guide to some of the most popular procedures and what you should know before you decide to nip, tuck, pull, vacuum, and/or lift.
Well, some operations can change your appearance. Other operations restore a more youthful appearance. Now, facelifts and eyelid lifts, well, they help roll back the years. Billy Crystal's character, Fernando Lamas, said it's more important to look good than to feel good. Now, I don't believe that's true, but sometimes it really does seem that our patients think that. Well, cosmetic surgery is trending towards less invasive procedures. Botox, wrinkle fillers like Restylane. Well, these have replaced many of the more invasive procedures in cosmetic surgery. By eating the right foods, by exercising, and by improving your mood and working conditions, and by reducing stress, you too can become more beautiful. But let's face it, many of you already live that life but still develop wrinkles. Your muscles pull on the skin when you frown and when you smile, and those wrinkles, well, they're really cracks in the dermis, the bottom layer of skin. It's like this piece of cardboard, Dr. Oz. Look, when you bend that, eventually that piece of cardboard is going to crack. And once you develop those wrinkles and once you develop those furrows, well, that's usually when you're in your mid-40s. They're not going to go away on their own. One of the easiest ways to look better is to have Botox injected into the forehead wrinkles. So what do you think? No, that's not the needle I use. We use little tiny needles. And I usually use an anesthetic cream before using Botox, so it really doesn't hurt. Now, Botox is used on the upper half of the face, but for wrinkles around the mouth, well, I use hyaluronic acid, which is Restylane. So we have this little gel of material, which is Restylane, and it's hyaluronic acid, and it fills in the wrinkles in your face. And it's a wonderful wrinkle filler, and it really has revolutionized cosmetic surgery. Plastic surgeons spend a lot of time figuring out new ways of torture that can really make you look better. Now, let's say you're a 70-year-old woman, okay, and your neck is beginning to hang, and your grandchildren are calling you turkey gobbler neck. Well, we're really talking about surgery here, and we can make that turkey gobbler look better with liposuction. And here's a liposuction tube. That doesn't look too friendly, but the ones that we use now are much smaller than the ones from the 1980s, and we can suction fat if your skin still has elasticity. But by age 70, well, a facelift is really the operation that most people need to lift sagging skin and jowls and to fix their bands in their neck. Now, facelifts can take a decade off your appearance. It really can. We often remove extra skin and we remove fat from the eyelids at the same time. These are still popular procedures. But you know, they've increased in popularity about 40% in the last decade, but in that same decade, Mehmet, tummy tucks have skyrocketed. Their numbers are up 445%. It's absolutely an explosion of procedures. All those non-invasive procedures, Botox, wrinkle fillers, liposuction, wrinkle removing lasers, well, they've replaced a lot of invasive surgery. But be careful. We don't want to use those terms like minimally invasive because there's really a lot of hype in cosmetic surgery. You know, when I put a needle like this under your skin, it's pretty hard to call that minimally invasive. Well, we've just mentioned the tummy tuck. Very, very popular right now because the baby boomers are done having their children, and their bodies really took a toll when they were pregnant. But tummy tucks, well, that has the highest complication rate of any surgical procedure in cosmetic surgery. Bleeding and blood clots in the legs are the biggest problems. During pregnancy, the midline belly muscles drift off to the sides, kind of like suspenders on a man who gains weight. Remember when you're 150 pounds, those suspenders are right in the middle, and by the time you're 250, well, they've drifted off to the side. the skin can grow very rapidly, and that causes stretch marks. Skin does shrink after the child is born, but the muscles, those are our six-pack muscles, well, they usually don't return to the midline. And that makes the belly pouch forward. The back goes back, the buttocks go back, and the belly pouches forward. And many women develop low back pain and poor posture after pregnancy. Well, since the stretch has been taken off of those oblique muscles, those powerful muscles of the belly, they don't work as well. Their tone is less. So we fix those muscles and we remove the extra skin in a tummy tuck. But do it only after you're finished having your kids, because if you have another pregnancy, you're going to undo the operation. Now, in 3 out of 4 tummy tucks, I suction off about a pound or so of fat. But if we do liposuction just alone with these wonderful tubes that we call these liposuction cannulas, well, I can remove up to 10 pounds of fat in one day and still send the patient home, and they'll be okay, because 10 pounds is really very safe. But beyond that, I think we want to be in the hospital or not do it at all. Well, Mehmet, finally, I want to mention America's favorite topic. Well, what do you think that is?
Sex?
Or baseball? No, it's breast implants. And these are 2 silicone breast implants. You know, they're exploding in popularity over the last year because after being off the market for 14 years, the FDA reapproved those last year. And so we have silicone gel breast implants and saline breast implants. Well, you can really feel the difference between gel and saline, but no implant is perfect. The gel ones feel and look more natural. They all rupture eventually, and removal is definitely more difficult with gel implants. But most importantly, all implants block mammograms. So if you have a breast augmentation, MRIs are the better way to go to stay safe. Well, plastic surgery is full of innovative procedures that can help make you look as good as you feel. But the right procedure needs to be done by the right doctor. To find Dr. Right for you, make sure your surgeon is board certified and that the doctor has privileges, this is important, in a hospital to do your procedure. And insist on seeing pictures of prior patients. Don't be ashamed to consider cosmetic procedures, but you need to be aggressive in getting the right surgeon and the right procedure by the right person.
Thank you, Arthur.
Thank you.